February is American Heart Month, and did you know that, like many things, heart disease affects women differently than men? And women of all ethnicities are at different risks. So that's why we're talking to Dr. Bridget Beck, a cardiologist from Rose Medical Center. And doctor, why is cardiovascular disease the #1 killer in women, and how does weight play into that?
Well, cardiovascular disease is the #1 killer of Americans in general. It kills more Americans every year and more women every year than cancer and lung disease combined. And there's many, many factors for that. And certainly weight plays a role in that. In part, it plays a role directly by increasing inflammation and insulin resistance, but also for many of the other risk factors that go with being overweight, such as diabetes and high blood pressure. And effectively, risk factors start piling on and culminate in heart disease.
Wow. So tell us, what are some of the worst things for a woman's heart?
Well, I tell all of my patients that diabetes and smoking are actually probably the 1st through 10th risk factors for developing any kind of heart disease. However, these are actually even more significant risk factors for women. Women diabetics are actually more likely to develop heart disease than men who are diabetics. Women smokers are more likely to develop heart disease than men who smoke. So those are extremely significant risk factors for everybody, but even more so for women.
Interesting. I know one of the interesting things we saw was a meat-based diet is on the list of dangerous things for women. Should women avoid eating meat entirely, or what should they know about that?
I think it would be very extreme to say that women should avoid eating meat entirely. Eating red meat eating red meat frequently certainly has been shown to increase people's risk for heart disease. However, to be fair, that's actually even just a few percentage points, whereas other risk factors kind of have a more significant impact. That being said, red meat should be limited even to a few times a month. However, eating things like fish or poultry are fairly safe meats and a good way to get protein. A lot of people who try to eliminate meats from their diet actually compensate by increasing carbohydrates or sugars, which actually can backfire. So I would actually not focus on trying to eliminate meat from the diet, but focus on getting healthy meats or meats with good fat in them, as opposed to simply avoiding meat altogether.
Great, that's some great information. And tell us too how stress and trauma can affect heart health.
So stress and trauma are another double-edged sword. Sort of in the immediate fact, stress or trauma increases adrenaline, which increases your heart rate, it increases your blood pressure, it makes your blood vessels constrict. All of those things put an extra workload on your heart. On the kind of other perspective of stress and trauma, a lot of times the coping mechanisms or lack of coping mechanisms tend to make things spiral on top of that. People tend to overeat or smoke more or skip their exercise regimen, all of which then indirectly add to the risk of heart disease.
And we know during COVID times, many people are avoiding doctors' offices because of the pandemic, not even going to their hospitals for heart attacks or strokes. So, tell us why skipping regular screenings is just such a bad idea and why people should be thinking about this.
Ultimately, with women, I would really just ask them to advocate for themselves. One of the biggest things that we see with women is that they tend to be the caretakers of their parents, of their kids, of other family members, and neglect their own health. And that's very typical, and that's very appreciated, and I'm sure by their family members as well. But it leads to them neglecting themselves, and then often not dealing with symptoms until damage has occurred or until it's sometimes too late to do anything about it. So I would really ask them to pay attention to their bodies and start advocating for themselves, not just other people around them. And even some doctors sometimes, because women often present with atypical symptoms. Now, they're certainly, most likely to have chest discomfort as their primary symptom. However, women are also, more likely than men to have something that's not classic for heart disease, shortness of breath or nausea, or simply fatigue that even an educated doctor may overlook. So if you know that something is wrong, you just need to advocate for yourself.
Great, that was wonderful information. Thank you so much, Dr. Beck, for all of that. And for more information about women's heart health and how to prevent heart disease, head over to cbsdenver.com. We'll be right back